We will learn all the relevant medical information about liver flukes or fascioliasis in this video. Fascioliasis is a trematode flatworm infection caused by Fasciola hepatica or gigantica. Although Fasciola gigantica primarily inhabits the tropics, Fasciola hepatica has a global distribution. Both parasites are hermaphrodites, have comparable life cycles, and affect people in similar ways clinically. Sheep and cattle are the organism's primary hosts, and they are affected by liver rot. Unintentional hosts are people. The primary hosts of Fasciola hepatica are sheep and cattle. However, it can also infect goats, buffalo, horses, donkeys, camels, hogs, deer, and rabbits. Fascioliasis significantly affects industry and farmers by infecting livestock. Snails are intermediate hosts. Humans are incidental hosts and most often acquire infection by eating watercress or water chestnuts grown in sleep-raising areas. Other freshwater plants including water lettuce, mint, alfalfa, and parsley can also spread the infection. Drinking contaminated water that contains live metacercariae can also infect humans. Due to an increase in snail populations and the prolonged survival of encysted cercariae, the prevalence of animal and human infection increases during wet years. What is the Fasciola life cycle? Immature eggs are discharged in the biliary ducts and passed in the stool. Eggs become embryonated in fresh water over 2 weeks. Miracidia are released from embryonated eggs and enter a suitable intermediate host snail. The parasites in the snail go through a number of developmental phases before producing cercariae. On aquatic plants or other substrates, the cercariae encyst as metacercariae after being expelled from the snail. Ingestion of flora contaminated with metacercariae, such as watercress, causes infection in humans and other mammals. After ingestion, the metacercariae exist in the duodenum and penetrate through the intestinal wall into the peritoneal cavity. After passing through the liver parenchyma and entering the biliary ducts, the immature flukes develop into adult flukes and begin to lay eggs. It typically takes 3 to 4 months for metacercariae to mature into adult flukes in people. Fasciola gigantica development could take a little longer than Fasciola hepatica. What is the clinical picture of fascioliasis? While liver and bile duct infections are the most common types of human infection, other body regions can also become infected. As the parasite moves from the intestines to and through the liver during the early acute phase, symptoms may develop. Gastrointestinal issues including nausea, vomiting, and discomfort in the abdomen can be symptoms. Other symptoms include rash, fever, and breathing difficulties. The clinical signs during the chronic phase, which begins once the parasite is settled in the bile ducts, may be the same or distinct, and reflect occasional inflammation and bile duct blockage. The pancreas and gallbladder can both become inflamed. How to diagnose fascioliasis? The parasite is the typical indicator of Fasciola infection in a person. Typically, this is accomplished by identifying Fasciola eggs in stool samples viewed under a microscope. To find the parasite, several specimens may need to be analyzed. Examining bile or the contents of the duodenum might occasionally reveal eggs. People who are afflicted do not begin passing eggs until after several months of infection. When the infection is acute, people do not pass eggs. As a result, the infection must be identified early on using methods other than stool analysis. Even during the chronic phase of infection, it can be difficult to find eggs in stool specimens for people who have light infections. Blood tests that look for antibodies to the parasite, as well as routine blood work, can be used to diagnose Fasciola infection. Imaging tests like ultrasonography and CT scanning may identify hypodense hypoechoic liver lesions that match the larvae's burrow paths. The adult fluke may also be seen via ultrasound in the gallbladder or bile duct. How to prevent and control fascioliasis? No vaccine is available to protect people against Fasciola infection. Individual people can protect themselves by not eating raw watercress and other water plants, especially from Fasciola endemic grazing areas. Always avoid eating or drinking anything that could be contaminated while visiting places with inadequate sanitation. The viscera of potentially infected animals should also be thoroughly cooked, as should vegetables grown in fields that may have received irrigation from contaminated water. How to treat fascioliasis? The preferred medication is triclobendazole. This medication is taken orally, typically in 2 doses. Most patients respond favorably to the therapy. In the end, if you liked this video, Do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.